Bob.
Yeah, yeah. And now I'd like to go to Dr. Dennis Spence, who has been addressing this area, and he has some ideas in the transition that we need to make. And I say the transition because what we need to do is recognize that we passed a bill last session in the legislature called Right to Try. And that was a bill that was going to give patients a right to use a drug that was still in trials when their situation was that there was no other option available. And so instead of having to wait another year or two or for a drug to finish its trial that was showing promise, we set it up so with the doctor's orders, we could allow patients a right to try. And I really think that what we have here is enough evidence in what we have that everybody should have the right to try on what you talked about. And in the meantime, I think Dr. Spence wants to talk to us about an area that I brought up, and actually one of the first calls we had with our state legislators and our Health and Human Services to discuss what was being done. When I realized that the people who are being affected, it was not as the government had advertised, that is that it universally attacked everyone, no matter what their age was, no matter what their sex, no matter what their race was, that everybody was vulnerable to it. And one of the first calls after we started getting data that shows that no, not everybody is equally affected by the COVID. And we're realizing that those people that had a compromised immune system were very vulnerable, and those with a really good immune system were far less vulnerable. So I asked the question is, well, what are we doing to help people understand that they can actually do something? This was before the COVID. I mean, before the hydroxychloroquine question came up. I said, why aren't we telling people out there that there's something they could do to make themselves less susceptible to it? And actually, I kind of got laughed at by the Health and Human Services staff, in that it's suggesting that people could do something about their immune system. So I was very pleased when I had this series of discussions, and Dr. Spence brought up on his own, you know, what people could do. So Dr. Spence, why don't you talk to us about what your suggestions are in the interim that folks could do?
Okay, well, thank you, Bob, for allowing me to join this really an esteemed panel. Everything that everyone has said so far, I heartily agree with. Even though I'm recently retired, doesn't mean I quit thinking or quit investigating things that are of interest to me. One of the things that my whole practice was based on was using common sense, and unfortunately, common sense seems to be missing in the discussion of how to treat, how to prevent, or how to go forward on the next stage for the coronaviruses. As most people are already well aware of, coronaviruses have been around for a long time. You can go to your local veterinarian and look at some of the medications they have on their own shelves. And one of the things is this disinfectant is used to treat coronavirus. So this is nothing new. In fact, Stella mentioned the 2005 study by the NIH. And ironically, I found a 2005 copy of National Geographic magazine with an article on the next killer flu. And the most interesting part about the article was the fact that the NIH and the CDC all were involved in making comments on this article, including the use of the chloroquines for treatment of COVID. So the whole thing, if this has been known since 2005, it really kind of rubs a person the wrong way when we realize that we've had the knowledge, but nobody was bringing it forth. And if they didn't, why didn't they? So there are other questions that still aren't answered. I guess what I really want to talk about is just what you already mentioned. What can somebody do to improve their odds against the virus? Well, we all know that a healthy diet, exercise, two things that everybody should be doing anyway. Vitamin and mineral complexes can be useful, supplements. B complex, especially B6, also vitamin C, unless you have signs and symptoms of the virus, you probably should stop vitamin C because it can exacerbate the cytokine storm that can occur if somebody has advanced COVID. Vitamin D3 and vitamin E, both fat-soluble vitamins that, by the way, you should take after a meal, not before a meal. And then, of course, zinc. We've already mentioned zinc. Zinc is a known antiviral agent, and zinc is actually in conjunction with the hydroxychloroquine is most effective. Spend more time outside rather than indoors. Indoors, especially in the South, in the air-conditioned comfort of your dehumidified rooms, actually promotes viral propagation, where getting outside in high humidity, UV light, helps decrease viruses. So the very thing we should be telling people is don't get locked down, stay in an apartment, get outside. Frequent hand washing and regular use of wipes and disinfectants. We've been talking about that. It's been mentioned, it's said over and over, but one of the things I've noticed, and I challenge everybody to go notice this, now that the mask mandates are out, what's happened to the wipes? What's happened to the disinfectants? Very rarely do we see those being used anymore, except in restaurants or in some of the Walmarts and the big stores. But just day-to-day use, we don't see them about quite like we did. Social distancing based on realistic factors and needs, not based on, once again, on a mandate or the fear factor. And we keep talking about the fear factor, and that is the most important thing that has been so wrongly spread among the population. Proper mask usage. If you're gonna wear a mask, wear it right. A mask that's wet, a mask that's dirty is an unhealthy mask. Now, I'm not one that thinks everybody needs to wear a mask, but that's a kind of a different conversation. Other adjuncts that are out there that we've known about for years, the use of UV light indoors. They are now developing new biofilters for HVAC systems down in Houston. Recent comment came out about that, and I think that's exciting. One other thing too that we really haven't touched on, but even stem cell research can be geared towards what can we do with stem cells to help boost one's ability to fight this virus. And then of course, the thing everybody else has already touched on, early outpatient treatment with evolving treatment protocols. These protocols can change, but right now, all of these guys have things that are working. Everybody is big on double-blind studies and peer-reviewed studies and all that, but believe it or not, when you have anecdotal evidence that something works, and that's the same evidence over and over and over again shows that something works, it probably works. Now, what can we do going forward? Well, we need to definitely make future plans, and we need to think of a regionalized approach that local doctors are involved in rather than a centralized approach to treating the problem with a government employed doctor directing all of our responses and using an urban city, a large urban city as a model. Certainly in Athens, Texas is not the same as a New York City, and neither are the people, neither the social interactions, neither are the living conditions. In New York, everybody goes in through a single door to a high-rise apartment. Here in Texas, you're more likely, or Oklahoma or anywhere in the Midwest, you're more likely to see individual houses with separate entries. So all those things are important. Protect the most vulnerable by quarantining them early on. Let the people with robust immune systems, which are the young people, especially the children, let them get out and carry on their normal activities. The chances are, just like we've said over and over, even if they catch the virus, it's going to be a very, very low grade response, and we are increasing herd immunity. Now, the biggest problem with the herd immunity thing is as we have all these mandated things that are preventing the robust, healthy individuals from developing their own immunity, we are literally, just as was mentioned before, kicking the can down the road. At some point, this virus is going to touch everywhere. In 1918, the Spanish flu virus, with the travel, the restrictions that we had back then, sailing ships, limited air travel, everything else, it was hard to get from one place to another, yet that flu was identified everywhere in the world. So yeah, our lockdowns are not the effective way to
And
treat
there were an awful lot of people died from.
That's right. That's
those
right.
where
And one of the
we
things
didn't
I
have
think is
medicines
real,
we have today.
well, one of the things I think is real important going forward too, is just like we did in the 70s, we had alternate days where we could go buy gasoline and it was identified by your license plate. What would be so difficult about having alternate days where the unhealthy, those that are susceptible to the virus, the elderly, go shopping, go dining one day, and then on the next day, the young healthy people go shopping and dining. Your businesses at least would be able to stay open and function.
Well, thank you, Dennis. Appreciate that very, very much. And I think, you know, again, it comes out, the common denominator there is early intervention and medicines at work. The term prophylactic's been used a lot. Folks, they don't understand that. That's a medical term for preventative mode of taking. You don't have it, but it works to help you not get it, and if it do get it, it reduces the effects on it from. And so, thank you very much.